Chronic toxic encephalopathy, or CTE, is a neurological disorder that usually represents a chronic, persistent, diffuse injury to the brain. This might result from cumulative or repeated exposures to solvents or heavy metals. These harmful chemicals can be inhaled or applied. The more common solvents to cause harm are alcohols, formaldehyde, and acetates, while the heavy metals include lead and manganese. They are commonly found with industrial applications and productions. The substances diffuse into the brain rapidly as they are lipophilic and readily transported across the blood-brain barrier. This is a result of increased membrane solubility and local blood flow. The central nervous system solvent uptake increases with high levels of physical activity.
CTE primarily affects cognitive functions. You can see this particularly in the onset of attention and concentration difficulties and short-term memory disturbances. It also has an effect on affective symptoms or emotions, as it is often accompanied with mood changes, particularly increased irritability and depression. The behavioral changes that might occur are often as a result of the former two clusters. Often, these changes persist after the cessation of solvent exposure, resulting in chronic functional impairment with attendant impact on function in daily life and work.
The cognitive and emotional symptoms developed by a person who suffers from CTE are not easily attributed to chronic exposure to toxins. Therefore, CTE is usually diagnosed after excluding other possible explanations for the symptoms. Additionally, an agreement of experts with multidisciplinary backgrounds is necessary for the diagnosis. The most common diagnostic procedure for CTE has several steps. First, the patient is interviewed by a neuropsychologist, but other professionals such as neurologists, psychiatrists, and occupational hygienists are often consulted. A physical examination is also required, accompanied by a neurological examination and neuropsychological tests. The neuropsychological tests measure the following: information processing speed, attention, memory and learning, verbal ability, and constructional functions. The World Health Organization published diagnostic criteria for CTE caused by exposure to solvents. There are three types. Type 1 is characterized by subjective symptoms relating to memory, concentration, and mood. Type 2 is characterized by objective evidence of attention and memory deficits, decreased psychomotor function, and/or learning deficits on neurobehavioral testing. Type 3 is often accompanied by neurological deficits and neuroradiological findings. This type of CTE often manifests clinical features, whereas types 1 and 2 show subclinical deficits. MRI is commonly used to assess the brain abnormalities in this situation. The most common finding is global and symmetric cerebral and cerebellar atrophy. Since cerebral matter shrinkage is not exclusive to CTE, we can say that the contribution of neuroimaging techniques is not significant. Therefore, neuropsychologists should rely more on the other steps towards the CTE diagnosis, such as the neuropsychological tests. Unfortunately, the cognitive and affective symptoms associated with CTE are not reversible, but slight improvement has been noted after exposure to the toxic solvents has been minimized by removing the subject from the source.
Even with the safest, most advanced safety protection gear, some level of exposure is imminent for certain people in relation to their jobs, such as spray painters, factory, and industry workers, as they get exposed to lots of chemicals in high concentrations all day long. How can their living qualities be improved knowing this fact?